It seems that the only other doctor busier than me are the gynecologists and OBGYNs because COVID babies are abound. A slew of patients that are coming in for kind of mommy rejuvenation. They just recently had babies, and there are so many questions that people have about treatments that they can do, when they can do it, what is good for them, what's the best approach. I did some posts on this this week, and I put up a question box, and we are going to answer that right now. Here we go. This is the number one question always. What can you do during nursing? Well, we don't inject drugs into pregnant or nursing women. We just don't do that. So injectables are kind of out. We can do lasers, we can do skincare, but no injections. When to start addressing stretch marks? The sooner the better. Even while pregnant, there are things you could do, especially if they are red, raised, itchy. Get on the bandwagon. Easy to clean up your room before they get too dirty. Which lasers can you use while breastfeeding? Pretty much any of them. I mean, you can do hair laser, Fraxel, broken capillaries, treatments for melasma, all that stuff. You want to get on that sooner than later. No injectables, as I said before, even if you pump and dump. No injectables. Wait, a dog barks in the distance. You hear that? Anyway, you can do lasers. I do hair removal. I do melasma treatments. I do tons of stuff on pregnant women. No drugs, and you have to be careful with the lasers because you're hormonally sensitive. You can do treatments while trying to conceive. It's just when you're pregnant, and it may even be safe to do injectables while you're pregnant. But I'm not about to experiment on women. Neither is the FDA. So keep it simple. Do all your treatments right before you think you're good to go. What's my favorite laser refresh? I mean, I love a good Fraxel and a vascular treatment like XLV or V-beam done at the same day, same time, 4-day recovery, and you can just wipe away the woes of pregnancy. PRP for hair? Absolutely. PRP for telogen effluvium. Some women get hair loss after pregnancy from the hormonal fluctuations. PRP in the scalp works. Don't like PRP in the skin for rejuvenation. If your stretch marks itch and they are red, get on the treatment ASAP. You could use a vascular V-beam laser. I love the new V-beam Prima. It's like the 3rd, 4th generation of the device. Get the red out and it stops it in its process. Now this is a longer conversation. There are injectable treatments you can't do while breastfeeding, but there are devices. M-Tone. Eventually, once you stop breastfeeding, you can do BioStim, Quo. We're going to do more talk about this at another time. I love this question. It doesn't make a difference whether you do liposuction before or after. It's good before because your skin is most elastic. It's tummy tucks you don't want to have more babies with. But liposuction, the earlier the better because you have the skin elasticity. Cool sculpting for baby fat. I mean, cool sculpting doesn't make a difference if it's baby fat or not. It's really for small pockets. That's it. You're not resculpting a body. I'm sorry, Allergan. You're not resculpting a body with multiple rounds of cool sculpting. How to flatten the belly? Depends what the problem is. Skin, muscle, or fat. Tumescent liposuction for fat. Adding some M-Sculpt to flatten the belly. Close the diastasis. Works great. And then a little skin tightening after that. Combo approaches. Short of a tummy tuck, M-Sculpt is the best for closing mild to moderate diastasis, particularly the new M-Sculpt Neo. Works amazingly so for most women. I'm always shocked at how good of a result you get. Start at 4 weeks after pregnancy. Lipo versus tummy tuck, which is better? Depends on the person. Only if the skin is dramatically pendulous, the muscle is split and bowled out, do you need a tummy tuck. I'm shocked by how amazing of skin retraction I get with simple tumescent liposuction. Bad acne during pregnancy. Yes, some people have bad acne during pregnancy. You can do certain treatments topically. There are lasers you can do for the acne, but certainly there are treatments, energy-based microneedling, Fraxel laser treatments, things like that for the scars, right? So many great treatments for melasma now. Topical approach. Oral medication approach for tranexamic acid works great. Combination light laser treatments, the P. Frank MD pigment protocol. We throw the whole gamut at you. There's no reason why you should have melasma. Do you have to be pre-baby weight to get some body sculpting? No. I do want you to start the process. Tumescent liposuction is not a replacement for getting your lifestyle back together. But, I usually wait about 3 months after you give birth before I do body sculpting. Oh, I love treating C-section scars. It works great. As soon as, literally when the stitches come out or at 1 month, V-beam laser, Fraxel, energy-delivered microneedling. Love treating C-section scars. Respond great. Start early. Yes, somebody brought up Umcella, the M-Sculpt for the pelvic floor. A lot of women have mild urinary incontinence after giving birth. Things get stretched down there. It improves sexual health, stops the urinary incontinence, gives better posture. Umcella treatments at 1 month. Lasers for stretch marks. If they're red and raised, hit it with the V-beam, energy-delivered microneedling, white stretch marks, Fraxel, textured stretch marks, Fraxel 1550 Restore. And don't forget about cosmetic tattooing, still great for the white ones. No, no, no. No injections during breastfeeding again. Even if you pump and dump, there may be someone that's willing to do it. I wouldn't do it on my wife. When's a good time for a lipo consult? I usually like to wait 3 to 4 months postpartum, certainly once you're done breastfeeding, because I can't do the surgery otherwise. But you really want to try and lose the weight first. When you've hit that wall, that's when I come in. M-Sculpt after birth. Start at 1 month, or when the OBGYN says you could do aggressive exercise. Tighten the muscle up earlier than later. Flatten the belly, close the diastasis. I love M-Sculpt Neo. It works so much better than the old M-Sculpt. When to schedule the first visit. Even if you're breastfeeding, it's time to start the conversation. I'll see somebody at 1 month. It's a nice break away from the baby. You come to the office. We have a nice discussion. You don't have to do anything, but you're making a game plan. No. Fat does not form in other places unless you gain a lot of weight. All forms of body sculpting must be done on people as long as they stay within 10% of their body weight. If you gain 25 pounds, yes, it's going to go to other areas, of course. What could you do during pregnancy? You see, an ounce of prevention's worth a pound of cure. Eat right, exercise, take care of yourself. Treat yourself like you would your baby when you're pregnant. Take extra care and you will benefit after. Ow! That was a lot of questions. Loving the new mommies. Love all the enthusiasm in the questions. It is not a mommy makeover. We're not making anything over. We are not recreating anything. We're helping people get their game back on, making the best versions of themselves. And I love it.